All right, good morning. It's April 4th. Welcome to the Health Roundtable for the City of Timmins. I'll ask Mayor Peary to start us off.
Once again, thank you very much for everybody being on this call this morning. First order of business, of course, is to extend our deepest condolences to the families of the individuals that lost their lives yesterday. Tragic situation. We know this disease is virulent, and more than 2 weeks into the state of emergency, we see deaths in the Porcupine Health Unit and in Timmins and Cochrane. My deepest condolences to the families involved and their friends, their relatives. And I want to start off, before we hand this conversation over to Dr. Canton, voicing utmost respect to the first responders and those that are out there, boots on the ground, dealing with this on a daily basis. These are tough times, and these are dedicated professional people, and we want to thank them for their service. With that, we'll hand it over to Dr. Canton, and she'll give you an update of the situation today in our region. Dr. Canton, thank you.
Hello. Thanks everyone for joining us today. And as Mayor Peary has already said, and as many of you have already heard and seen through our channels and emails and media releases, yesterday I had the absolute most unfortunate duty to report that we had our first 2 COVID-19 related deaths in the Porcupine Health Unit region. To share the death of anyone related to COVID-19 is terrible and tragic and sad for everyone. To do this twice in one day is incredibly sad. Of course, the greatest loss is for the family and friends of the individuals involved. We again extend our deepest sympathies to the family, friends, neighbors, and communities who lost a member yesterday. We also continue to thank all of the medical staff, first responders, and other community partners who continue to support all our community members and who provided their best care possible to these individuals and their families. The current number of confirmed cases is now 29 for the Porcupine Health Unit area. We cannot stress enough that COVID-19 is now circulating in our community. We have several cases that have not been linked to international travel or to other cases. And again, this means that we are seeing local transmission. And again, that means we need your help. Yesterday, the Government of Ontario announced additional business closures to stop the spread of COVID-19. And while we know this has a tremendous impact on all of our communities and community members, it remains incredibly important. Today, locally, the Porcupine Health Unit COVID-19 information line is open again from 11 to 3. And the toll-free number is available online and on our website and on our social media channels. We also have the Timmins COVID-19 Assessment Center open today from 11 to 3. And again, while it is by appointment only, please contact the Porcupine Health Unit should you have any concerns, and we will try and go through the assessment with you and determine if an appointment is necessary. Another announcement yesterday was with respect to a potential risk of a small exposure to a COVID-19 individual who attended the Lord's Kitchen on March 12th at dinner, March 13th at lunch, and March 20th at the dinner time. At this point in time, we have taken a very precautious approach, and we have advised any patrons or volunteers who attended at those specific times, if you have symptoms currently potentially related to COVID-19, to please contact the Porcupine Health Unit or your primary care provider for assessment to see if potential testing is warranted. If you do not currently have symptoms, we are outside of the window for self-isolation, but continue to promote self-monitoring as we do for every community member. And this means to watch for any symptoms potentially related to COVID-19. Should you have any symptoms, whether you were in that location or not, we ask you to self-isolate and call the Porcupine Health Unit or your primary care provider for next steps. So, in closing, we just want to reinforce that we need everyone in every community to continue the tremendous commitment to protecting all of our community members from COVID-19. We wish everyone well. Continue to follow infection prevention measures such as washing your hands frequently, not touching your face, washing down commonly touched surfaces, staying home as much as possible, limit your outings to essentials only, and only send one person from the household, not the whole family, to the store. And to please practice physical distancing when you are out in public for any means or any reason. And this again means 2 meters from others at all times. Enjoy the wonderful weather we're having today and in the future with your immediate family only. Stay well and stay safe. And again, our deepest condolences for the families involved and our utmost gratitude for those who continue to be dedicated to making sure that we're protecting everyone in every community. Thank you.
Thank you, Doctor. Just an opportunity for the media now if there are any questions.
Hi, yes, Angela from CBC.
Go ahead, Angela.
Yeah, why do you think the numbers are so high for the Porcupine Health Unit's area?
Well, I don't know that I would say they're high. I don't think they're unexpected. We did expect that we would see cases, and we do expect this number to increase. We have several cases that have been connected, and that constitutes sort of the biggest grouping of cases that were related. And just to say that, you know, through the important public health follow-up and investigation process, we were aware of all of the contacts and had followed the testing procedures in order to identify those individuals. The one thing we did not expect to see this early, although had been warning about since before we noted it, was the local transmission. And so that is when we see cases that are not related to international travel and not related to other cases that have been identified. And so that is where we really need every community member in every community to act as though COVID-19 is already within the community and take the necessary precautions. Thank you.
And are you able to touch on how the hospital is coping and how many ICU beds may be there in Timmins?
Hi, thank you. No, I'm not going to respond with respect to specific hospitals. I think those questions need to be directed to the healthcare providers. I will say, however, that we have been working really diligently with all of our healthcare sector partners across the Porcupine Health Unit District to both prepare for and respond to COVID-19. Thank you.
Thank you, Doctor. Any other questions?
I have a couple more, if that's okay, unless other reporters would like to go ahead.
Yeah, I think we can. The doctor can take probably one more question before she's got to run back. So go ahead quickly.
Oh, okay. Are you able to touch on whether there are any doctors or nurses in your coverage area who may have the virus?
I'm not going to discuss on that at this point in time. No, sorry. Anyone who has been tested or has been identified as a case or potential case is following the self-isolation procedures and precautions as necessary. Thank you. Is your next one quick? I'll do one more, or I'll try.
Okay. All right. What more needs to be done in the Porcupine region to slow the spread of this?
I think the biggest thing we need, and we have seen, I believe, positive changes in this direction, and we have seen many community members and many communities really step up and follow the public health procedures. But we know from the modeling from the ministry yesterday, from Public Health Ontario leadership and the Ministry of Health, that the public health measures are really the first step. They are the biggest, most important possibility for us to reduce the impact of COVID-19. And so for those who are following all of these precautions, I want to thank them and encourage them to continue doing so. And for those that have sort of thought maybe we could wait a little bit longer, I would just like to please again urge everyone to follow the public health measures and stay home as much as possible to protect us all. Thank you.
All right, thank you, Doctor. Now we'll ask if there's an update today from the Timmins and District Hospital.
Hi, yes, we've got a quick update. It's Keely Russell from the Timmins and District Hospital. So we continue to work in conjunction with the Porcupine Health Unit and other healthcare agencies to ensure that we're ready to meet the needs of the COVID-19 pandemic in our region. We want to send our condolences to the family and friends of the two individuals who lost their lives due to COVID-19. We also want to send our thanks and appreciation to all of our dedicated frontline workers who continue to support and care for our community every day. To ensure their safety, the safety of all of our patients and everyone else in the community, we can't ask you enough to follow the directions that are being provided by the Porcupine Health Unit. Please take all the necessary precautions to slow the spread of COVID-19 in our community. And we also want to thank the community for respecting the visitor restrictions that have been put in place at the Timmins and District Hospital. These restrictions, while difficult, have been put in place to save lives. If you suspect you have symptoms of COVID-19, the Timmins and District Hospital is urging you to call the Porcupine Health Unit or your primary health care provider. If you require immediate medical attention, please call 911, and if you're able to answer the screening questions, this allows EMS personnel and emergency department staff to take all necessary precautions. The Timmins and District Hospital continues to respond to general inquiries from the community. So if you do have a question, please contact us at our general information line at 705-267-2131, or you can email us at generalinquiries@tadh.com. If you are looking for additional information as well, we also encourage you to look to the Porcupine Health Unit or Ministry of Health website. Links to these websites can be found on our webpage. We ask that everyone stay safe, stay home unless it's absolutely essential travel, and please make sure you wash your hands often. Thank you.
All right, thank you, Kaylee. At this point, we'll ask Brian Marks to offer some updates from the DSAP.
Good afternoon. I'd also like to express our condolences from the DSAP for the to the families of those who passed away this weekend. In terms of emergency medical services, we continue to see an increased call volume in the city of Timmins. Yesterday, we transported 3 patients who failed the screening. Assessment Center in Timmins remains open, and paramedics are available for staffing. On behalf of all of the paramedics and DSAP employees, I'd like to reinforce the statements from public health to stay at home and observe all appropriate social distancing protocols, wash your hands to help prevent the spread. For our seniors buildings, for anyone out there who has relatives who are living in our seniors buildings, please refrain from visiting. There is a no visitor policy right now. If you would like to check up on relatives, please use the phone. You can also contact our housing department through our number 705-268-7722. Just follow the prompts to get to the housing department. We are conducting wellness checks to ensure everybody is safe in their units. In addition, if for the other DSAP services, if you need to apply for assistance, you can do that over the phone. Same number, 705-268-7722. In terms of food security, the scheduled distribution calendar has been posted on the DSAP website. It's www.cdssab.on.ca. Today there is a food distribution at the Lord's Kitchen from 4 to 5:30. For the homeless population, we currently have 20 residing at Northern College, intending to send another 5 there this weekend. Living space personnel are working hard 24/7 to ensure social distancing is in place, both at the Northern College and Cedar Street location. Cedar Street remains open for anybody who has to require supports during the day for service providers in Timmins. Thank you very much, and enjoy your weekend.
Thanks, Brian. Next, we'll go to Chief Loughran.
Good afternoon, everybody. First of all, I just want to, on behalf of Emergency Management, our condolences to the families of those affected yesterday. And I also want to echo Mayor Peary's comments and a shout out to the first in-line responders and the great job and effort that they are putting out under some trying times for sure. From an emergency management perspective, what the city really is looking at is we continue to meet and share best practices with all the partners, many of them that you hear from on a daily basis. But I mean, there's a huge table of people that are planning all kinds of different things behind us. And really what it is it's a coordinated emergency response that looks at operations, logistics, planning, and finance. And really the big role there is to ensure that critical services continue. We now are looking out probably closer to the end of June as it relates to planning from a community perspective. We look at healthcare and impacts on staff, and one of the biggest challenges that we're looking at right now would obviously be the PPE. I don't think we have any differences here in Timmins than we have anywhere else in Canada. And the other part that is very, very important, and one of the big reasons that we are doing this on a daily basis, is we need to ensure that all citizens are taking this seriously. Again, if we're going to get beyond this and get back to some type of normal, that's really, to me, is the key message on a daily basis. Again, thanks very much for your time in doing this.
All right, thank you, Chief Loughran. Before the mayor's closing comments, I'll just check in with the media to see if there's any questions for any of the speakers this morning.
Is the hospital representative able to answer my questions about ICU beds?
I think
Oh, go ahead, Dave.
Sorry,
I was going to say, I think if you can just state your question again,
sure.
You'll likely be able to chase that down and then get back to you.
All right, thank you. So I'm just wondering how the hospital is coping, and if you can tell me how many ICU beds are available at the hospital in Timmins?
So what I can say, and it's been echoed in the daily calls so far, is that the hospital is working through our pandemic planning process. So that process is something that started the moment that novel coronavirus became known. And through that process, building capacity in the hospital has been started. So we have built the capacity of an additional 51 beds in the hospital. As far as ongoing, that pandemic planning process is a extremely fluid process. So it will continue 24 hours a day, 7 days a week, in order to meet the needs of the community in our region.
Okay, thank you.
No problem.
Thanks, Haley. Are there any other questions from the media?
Hi, David Tadane from
Hey.
Rogers Sports and Media. Just wondering if Chief John Gote is on the call.
I am, Alain. Go ahead.
Hi, Chief. Just wondering, with the mayor announcing the state of emergency and that he's looking into implementing a potential curfew, how would that work from a police standpoint?
Yeah, thanks for the question, Alain. At this point, I'm actually doing a bunch of research in that regard because this is new ground for all of us here in the city of Timmins. I am looking into that as we speak, and I'll probably bring that back to the group, the emergency group, and the mayor probably first thing Monday or early next week.
Thank you.
Right. Thanks, Chief. Any other questions? All right, Mayor Peary, closing comments?
Again, deepest condolences to the families that lost their lives, friends, relatives, associates. The message stays the same. We have to keep 2 meters, 6 feet apart. have to ensure that you're safe, or that your family's safe. Dr. Canton has said a few times that this virus is circulating within our community. I don't know, perhaps, that that's fully understood. Essentially, that means you have to assume everybody you meet has the virus and take the appropriate precautions. That message has been the same. It's consistent. Wash your hands, cough into your sleeve. I will add a bit to the message today in relation to a comment I had this morning from a small business owner, grocery store owner. The basic issue is this. We, within the city, under the declaration of state of emergency, do not have the authority to close businesses down. If you are unsure and cannot provide for the safety of your employees and are worried about them, you do, whether you're on the essential list or not. McEwen Mining, of course, mining operation was on the essential list, and they shut their operations down. So you, as a business owner, can shut your business down anytime you want. You don't have to look to be ordered to do so, and in fact, the city can't. So it's your responsibility to protect yourself, and it's clear that that responsibility lies with you, ultimately. With that, thank you much for attending today. We'll be doing it again tomorrow, and we'll be following up every single day in this. I want to say again, thank you to everybody out there that's doing their part to help us get through this. It's a very serious situation. Thank you.
Thank you.